So, MRI could be completely wrong about the cause of your pain. Okay, I already guessed you don't believe it, correct? Because that sounds impossible, right? After all, if the MRI shows a disc herniation, arthritis, or a torn tendon, then that must be what's causing the pain. Well, is that so? No, not necessarily. One of the biggest misconceptions in modern medicine is believing that pain and imaging always tell the same story. They don't. In fact, thousands of people have severe abnormalities on MRI scans and feel absolutely no pain. Others have disabling pain despite scans that appear almost normal. How is that even possible, you ask? An MRI is an extraordinary tool. It can reveal anatomy in remarkable detail. It can show disc bulges, tendon degeneration, cartilage wear, and joint changes. But an MRI cannot tell us one crucial thing: which structure is actually generating your pain. Many MRI findings are simply part of normal aging. Research has shown that disc degeneration, disc bulges, meniscal tears, rotator cuff abnormalities, and tendon degeneration are frequently found in people who have no pain at all. An MRI shows what is there. It does not always explain why you hurt. Imagine arriving at the scene of a car accident. You notice a broken street light. Did the street light cause the accident, or was it damaged during the accident? Simply seeing damage doesn't automatically identify the cause. Medicine works the same way. Clinical examination, movement assessment, symptom behavior, neurological testing, palpation, ultrasound, and patient history all help determine whether an imaging finding is clinically relevant or simply an incidental finding. Treating the MRI instead of treating the patient is one of the most common mistakes in musculoskeletal medicine. I've seen patients with large lumbar disc herniations who returned to normal activity without surgery. I've also seen patients with almost normal imaging who were unable to sit, sleep, or walk comfortably. The difference wasn't the MRI. The difference was understanding the entire clinical picture. An MRI is one piece of the puzzle. It is not the puzzle itself. The best diagnosis comes from combining imaging with careful clinical reasoning, physical examination, and an understanding of how pain actually works. So the next time someone tells you that MRI shows everything, do not confirm that. Instead, take a second to think and then ask a better question. Does it really explain my pain? I am Jerry Ivanov, and this is The Science of Pain, where evidence meets clinical reasoning.